Hi everyone, my name is Mark Taubert. I'm a palliative care consultant. I'm at Llandoch Hospital here today, where part of my work is in Cardiff. Today I just wanted to sort of talk a little bit about palliative care more generally and how it can be quite helpful for people living with metastases. So in my work I see people in the hospitals, in the hospices, but also in outpatient clinics and sometimes in acute assessment units as well, sort of for instance in Velindre. Often I work hand in hand with specialists like oncologists or surgeons or hematologists, and we work alongside each other. There's a bit of a myth, I think, amongst some people that palliative care, sort of usual care ends and then suddenly palliative care starts, and that's just the last weeks of life. That's complete nonsense, and it's been really transformed palliative care over the last 10 to 15 years. And palliative care is often sort of a parallel track together with other specialties, or, be that oncologists or respiratory doctors and various others as well. So we work in parallel. In fact, we often discharge patients nowadays when their symptoms are more controlled. Where do palliative care get involved? Well, we get involved from diagnosis onwards sometimes. So I sometimes see people who've literally just been told that they've got a cancer, and maybe the oncology doctor or the surgeon says to me, Mark, there's some issues with pain or with some nausea from the treatments we've been giving, or for instance with breathlessness, and then myself or the team, they come in and we look at the different symptoms. We talk about the fact that we're from palliative care, but that we're sort of there for symptom control really and for supportive care. That's just a little aspect of what we do. And then once we're on top of the symptoms, which is most of the time really, helped with pain management or sickness, nausea, vomiting, then sometimes we talk about other topics such as what's important to you, who are the important people in your lives, how can we help with that. We sometimes put people in touch with welfare rights people, finance people, help with grants when you have a cancer, help with all sorts of things. There's day services as well that are run by teams like City Hospice and various others as well, which can be quite nice. But actually sometimes we say to the patient, look, your symptoms are much better now. You may have a life-limiting illness, but we really can't give you a prognosis. We don't know how long things will be going on for. It could be many, many years. So we're going to discharge you from our service for now, but here's our phone number and here's how you can get in touch. Equally, sometimes I have patients who come to my outpatient clinic every few months. We keep on track of some of the symptoms. Other colleagues locally also have clinics where they sort of assess people for things like breathlessness or pain and that sort of thing. And I've been, many of my stage 4 cancer patients I've been seeing for many, many years, and some of them have discharged back to the care of what I call the generalist palliative care provider, which is the general practitioner or the oncologist or the oncologist key worker, which is the clinical nurse specialist, and they can help with most of the basics or re-refer back to myself if that needs to be done.